Okay, how's everyone doing? Y'all hanging in there? Yeah, you're good. Good. Well, we're really excited to have you this afternoon. I have the great privilege of introducing Amireh Ghorob. She's our next speaker. I'll tell you a minute about how I met her, and then I'll read her official bio, which is very long. So we had the great privilege of partnering with the UCSF Center for Excellence in Primary Care, where Tom Bodenheimer's shop is, over the course of the years, is Care Oregon. And so David Labby, who some of you may know, and I were working on a curriculum for medical homes, and we sent it down to Tom asking, what do you think about this? Does this seem reasonable or not? And Tom said, it looks awesome, and you have to meet Amireh. She is the best trainer on this stuff ever in the country. So not to oversell you. So we had her up, and it's been a fantastic partnership, and we're really excited that she's here today to get to talk to you guys. So Amireh serves as the Director of Practice Coaching and Training at the Center for Excellence in Primary Care at the University of California, San Francisco. She has 15 years of experience working with underserved and vulnerable populations in both public health and in secondary settings. Right now, she's developing a curriculum in practice facilitation, health coaching, panel management, and complex care management, everything under the sun. As a master practice coach, she provides support and resources to assist primary care practices in transforming to a model of team-based, population-focused care that she is going to share the care. So I think you're going to hear about that today. She has a lot of experience and knowledge about transformation process in primary care clinics in the San Francisco Safety Net, in UCSF Primary Care, and the Greater Los Angeles VA, and in clinics throughout the country. Also, she's trained thousands of health coaches and panel managers in the U.S. and in Canada. As manager of the landmark randomized control trial at UCSF, her team found that peers who were trained as health coaches can clinically and significantly improve A1Cs in patients with diabetes. It's really cool. You guys should hear that data sometime. Her prior work experience includes developing health toolkits for urban adolescents, conducting policy research around insurance coverage, and working as a consultant for the Environmental Protection Agency. And she didn't put this on here, but she used to be a basketball coach too. So all of this coaching stuff, she knows what she's talking about. Okay, welcome Amireh.
Thank you. Okay. So when Dave and Mindy asked me to come up here and talk to you lovely folks, I thought there's like a whole bunch of brilliant Oregonians that could get up here and do this, and their experience and their like expertise is so much better aligned with what you folks are dealing with. And then after I signed the ironclad agreement, it was revealed to me that the keynote placement was right after lunch. And I thought, I get it. I've been duped by my neighbors to the north. And so I thought, what could I bring here and talk to you brilliant folks about? Because literally, and figuratively, we look up to Oregon. At CEDC, we love Care Oregon in particular. And I thought, there's something that every clinic I've ever been to struggles with. Actually, most people on the planet I know struggle with it, and that's change. So today I'll be talking about change. And it might surprise you to know that when I'm asked to present places, I am a very people-friendly presenter. I reuse the cycle. But in this case, I realized that most of the knowledge I have about change and what I go to practices and talk about was like stuck in my head. And I was like, oh, okay, so I need to create something. And so I thought, the way I'm going to get that back is I'm going to set a new presentation. So this is a new presentation. It's really interactive, as most of my presentations are. So let's see how it goes. It's going to be a journey we're going to take you on.
I thought this picture was really appropriate for this. I think in many cases, what we're doing, there is no road ahead. And there are, a handful of places in the country that have figured out what that road means to them, but what that road could mean to you is something totally different. So we're all kind of paving our own road, and hopefully in this room together and with national expertise, we can help each other out. So here's what we're going to talk about. What are some successful ingredients for change? Then we have two cases in the end around huddles and teams, because they told me you guys want to talk about teams, and I know why. So let's take a little vote. According to the Harvard Business Review, what percentage of change initiatives fail? If you think it's A, 20%, raise your hand. B, 50%, raise your hand. C, 70%, raise your hand. And D, almost 99%, raise your hand. The answer is C. So most of you are feeling that. You're experiencing this, okay? So it makes sense. And this is just a quote that I find to be really relevant to this particular topic around change. Getting a new idea adopted, even when it has obvious advantages, is often very difficult. So we're going to talk about why is that so difficult for us to change. But before we talk about that, let's talk about what the alternative is. So what are some of the alternatives to change? Anyone? Just stay the same. Do the same thing over and over again. Wait for something magical to happen.
Point fingers.
Wait for the unicorn to show up and magically change the practice. Now, most unicorns I know aren't really into primary care, so you could be waiting a long time. But that's an option, and a lot of places have done that. They just kind of magically, they're waiting for something magical to fall out of the sky and make it happen. Or you stay the same and then you die off like dinosaurs, right? But there's other answers. So we're going to talk about other answers today. There's hope. So that's what we're going to talk about today, the ingredients for successful change. But first, I want to know what you know. So I want you to take 2 minutes and write down some of those 6. What are some successful ingredients you know that you need for change to happen? Just make a little list, jot it down.
Okay, so the first ingredient that I think change requires is a vision. You need someone who's at the helm of the ship, who is setting the vision. What is this going to look like when we get there? How will we know when we get there what it looks like? So many places just start changing, and they never have that vision that kind of unifies and gels everyone together on the same page, right? Where are we going? How are we going to get there? But the thing about leadership, and this is really, a no-brainer, is to be a leader, you actually need people following you. So think about what that means, for instance. I'm sure you all know people who are visionaries. They have great vision. They think big thoughts. They're changing the world in their minds. But they look behind them and there's nobody there. They're so far ahead of the pack, and there's no one behind them. So they're not really leading anyone. So those people are great to have. You need visionaries. But you also need people that are willing to reach back and lead people somewhere. Where are we going? How are we going to get there? So this is a chart that we've had before. It's about adoption of innovation. And in this particular case, it's about marketing capability. But what's interesting is that you'll see that most people are not innovators and early adopters. Most people fall in that big middle chunk of developers. They're the early majority and late majority of adopters. What does this tell you? For most people, change is hard. It takes a lot of work, a lot of convincing, a lot of time to get those people in the middle to move. Now, in this room, there may be a lot of innovators and early adopters. So a lot of you may feel really frustrated with what they do. And you're like, why isn't anyone else listening to me? Why am I all alone? And you go home and you have a glass of wine and you don't have it. So what I want you to know is you need to reach out to other people like you in this room to feel supported and feel good and feel sane almost. Feel like, okay, this makes sense. Because this person also makes sense. Because when you're around the people in the middle, the majority there, the early and late majority, you might feel like crazy. You might feel uninspired. You might feel really exhausted and tired. Okay? So it's important for you to reach out to your peer network and connect to those people around. Okay, so when we talk about leadership and we talk about leaders actually leading other people, it's also about how you present what it is that you're trying to get people to do. If it's something that's crazy and too far ahead of the curve, people are not really going to catch on. It's like going back to, 1895 and talking about iPhones. Think about, we went back to 1895, we got in our time machine, and we went back there and we tried to tell them about iPhones. What do you think they would do? There's this device, you hold it in your hand, it connects you to other people, and this thing called the internet that you can't really see. but a stick, and you get all your information from it. And eventually people stop talking to each other and all they use is a stick. So I'm going to show you a video about how leaders actually lead.
If you've learned a lot about leadership and making a movement, then let's watch a movement happen start to finish in under 3 minutes and dissect some lessons. First, of course, a leader needs the guts to stand alone and look ridiculous. But what he's doing is so simple, it's almost instructional. This is key. You must be easy to follow. Now here comes the first follower with a crucial role. He publicly shows everyone else how to follow. Notice how the leader embraces him as an equal. So it's not about the leader anymore, it's about them, plural. Notice how he's calling to his friends to join in. So it takes guts to be a first follower. You stand out and you brave ridicule yourself. Being a first follower is an underappreciated form of leadership. The first follower transforms a lone nut into a leader. If the leader is the flint, the first follower is the spark that really makes the fire. Now here's the second follower. This is a turning point. It's proof the first has done well. Now it's not a lone nut and it's not two nuts. 3 is a crowd and a crowd is news. A movement must be public. Make sure outsiders see more than just the leader. Everyone needs to see the followers because new followers emulate followers, not the leader. Now here come 2 more people, then 3 more immediately. Now we've got momentum. This is the tipping point and now we have a movement. As more people jump in, it's no longer risky. If they were on the fence before, there's no reason not to join in now. They won't stand out, they won't be ridiculed, and they will be part of the in crowd if they hurry. And over the next minute you'll see the rest who prefer to stay part of the crowd, because eventually they'd be ridiculed for not joining. And ladies and gentlemen, that is how a movement is made. So let's recap what we've learned. If you are a version of the shirtless dancing guy, all alone, remember the importance of nurturing your first few followers as equals, making everything clearly about the movement, not you. Be public, be easy to follow. But the biggest lesson here, did you catch it? Leadership is overglorified. Yes, it started with the shirtless guy, and he'll get all the credit, but you saw what really happened. It was the first follower that transformed a lone nut into a leader. There's no movement without the first follower. See, we're told that we all need to be leaders, but that would be really ineffective. The best way to make a movement, if you really care, is to courageously follow and show others how to follow. When you find a lone nut doing something great, have the guts to be the first person to stand up and join in.
Thank you. Did you love it? It was worth the wait. So let's go back to this. All right. So the innovators, the people that are thinking about it, right? But maybe that guy before he got up to start dancing, he was thinking about dancing, right? He's like, I'm going to get up here and dance like a crazy person. And then the early adopter, the first guy that got up, do I have a beam on this guy? A beam? A laser beam? No, laser beam. Okay, so in the early adopter red stage there, that one guy got up and started moving. But the important part was that he got someone else up and moving, right? The follower, the person that comes with you on your journey. Because if you're just leading and nobody's following, you're not leading anything, okay? So in your practices, it's not enough that there's 1 or 2 people that have these great ideas. And there's not enough that there's one person that's leading, that has all the ideas and loves those ideas and is doing something about them. You actually have to get other people to follow. You have to get it to be a manageable thing to do and make it easy enough to follow. Okay. So the second ingredient I think that it requires to make change successful is a dramatic shift in core beliefs. Now when it comes to healthcare, what that means is moving away from this idea of the lone physician doing all of the work in the clinic. This idea of toiling for hours upon hours by yourself, you're a hero, and you go from countryside to countryside with your bag. This is outdated primary care. The new model of primary care is working in small teamlets, where you and this other person, where the clinician and somebody else on the team who's a non-clinician that's empowered by the clinician are providing direct care to patients who are no longer just kind of people we do things to. They're people that are engaged, they're clients that are engaged in their own care. We work with them together on their care plans. And everyone is working at the top of their license, which really means that everyone is doing the right care at the right time for the right person. And the clinicians are doing what they're licensed to do, which right now, a lot of clinicians are doing things that, frankly, could be done by somebody else on the team. And the idea that that's possible is really scary for some people. And getting over that fear and letting go of that control, as a practice coach, helping those people do that is part of your job. It's part of your role. And remember we said change takes a long time? This process will take a long time. And that's okay. It's okay. It's a journey we're on. We're not going to get there tomorrow. So we're going to talk a little bit more later on about how do you empower other people on the team and what we call the share the care model. So this article that I referenced down at the bottom, by the way, The Mythology of the Lone Physician, it outlines some of these shifts in core beliefs. Some things that I just mentioned, for instance, right? So moving away from the individual hero to the well-being of the team, moving away from this is my patient to this is the care that we provide. Not even this is our patient. This is the care that we're able to provide. It's a shift. It's a different way of thinking about providing care. So the other thing that successful change requires is an acceptance of something. An acceptance of something new and a loss. Accepting the loss of something that you've been doing or a way you've been doing something for a very long time. So it starts, though, with self-acceptance, which really means you're measuring where are we now, where am I now, and to do that requires some honesty. It also requires some data, right? This is where data becomes meaningful. Data is only meaningful if it allows you to see where you are now and allows you to track where you're going, right? And this idea of looking at yourself in a very honest way is very difficult for most people to do. And as a practice coach, you're kind of that mirror. And that gets frustrating too, right? Because you feel like you're the bad guy sometimes. You gotta tell people the truth. You gotta really show them the data that shows them this is where we really are now. You may think you have great access, but your third next available appointment is in 3 weeks. Not the best access ever. Not terrible, but it's not the best. It also means kicking habits. Now, what do we know about humans and habits? We like them. Not only do we like them, but what else? Well, we know that for sure. So the earlier you've adopted that habit and the longer you wait to break it, the worse it's going to get. But really, we're hardwired to form habits. So let's accept that about ourselves. We're talking about self-acceptance first, right? So accept that we are habitual creatures. We like to do the same things over and over again because they're safe. And we know that it works. So for instance, 10,000 years ago, when people were exploring the countryside and they were testing out that berry bush, remember the innovators that went out into the field, the leaders that went out into the field and picked those first berries and died because they were poisonous, right? We learned from those people. We're like, oh, we're not eating those berries. Those are the poisonous berries. We're going to stay away from those. And then we found the berries that were healthy to eat that wouldn't kill us. And we just kept doing that over and over and over again. This is hardwiring. We are hardwired to be creatures of habit. So it is very difficult to break one habit and start a new habit. And I'm telling you this, you know this, right? But I'm telling you this so that you start to realize when you're in your practices, like, wow, I'm doing something really challenging. And I'm asking people to do something really challenging. This is hard work, and it's going to take a little bit of time. It's also an acceptance of the loss of time invested in the old way. Now, I'm going to put this in terms of something you may understand a little bit better, and that's relationships. I'm sure all of you have dated someone and have stuck around way too long in that relationship. And part of that is because we've invested time in that relationship and we're like, but I've been with him for a year. But it's terrible. But I've been with him for a year. Right? So if you've been doing the same kind of care for the last 10 years and you're good at it, I'm good at this old way of doing things. It's really hard to shift over to do something new. And it requires the acceptance that you've lost that time. Yeah, the 10 years you've been doing it one way, we're going to try something new that's not outdated, that's going to keep us viable in the market. And then it also requires a shedding of the helpless mentality, that I'm a victim, I can't do anything about this, change is happening to me, and I'm just here and I have to accept it, or I can leave. So I want to share this poem that I found. I think it's really insightful about human behavior and change. I'll just read it. You can read it too. I walk down the street. There's a deep hole in the sidewalk. I fall in. I am lost. I am helpless. It isn't my fault. It takes forever to find a way out. I walk down the same street. There is a deep hole in the sidewalk. I pretend I don't see it. I fall in again. I can't believe I'm in the same place, but it isn't my fault. It still takes a long time to get out. I walk down the same street. There is a deep hole in the sidewalk. I see it there. I still fall in. It's a habit. My eyes are open. I know where I am. It's my fault. I get out immediately. I walk down the same street. There's a deep hole in the sidewalk. I walk around it. And finally, I walk down another street. So habits take a long time to break. It's okay. It's human nature. We learn or we fall into the hole and we get stuck there, and everyone else is going around us and they're living their lives. So let's do a moment of reflection. I want you to think of something personal. Let's personalize this. Remember Mindy was talking about getting to the personal, that energy inside of you, the personal reasons for doing things? Think of something you've been trying to do or change in your life. So picking up a new habit or maybe breaking an old habit. We all have one of those things. Let's all be honest. Self-acceptance. Okay? We all have something we've been trying to start or a habit we've been trying to break. Do you have it? Think about it, think about it, think about it. Oh no, what is she going to make us do with that thing? So no, I'm not going to make you do anything with it, not loud, okay? What I want you to do is think about where you're trying to go. We're in clinics asking them to set visions and goals all the time. When you start personalizing, you realize how hard it is to actually change something. So think about in your mind about that thing, and what is your vision for that thing? Where are you trying to go with that thing? What's your goal? Write it down. No one's going to look at this. It could be anything. This is your paper. But I'm forcing you to do what we want clinics to do. We want clinics to set visions and goals. It's not that easy. And now I want you to do a little bit of self-acceptance and write down, where are you now with that thing? So maybe your thing is like you want to exercise more. And your vision and goal is, I'm going to exercise every day. That's where I want to be. Every day I want to work out. For an hour I want to walk. But maybe right now I'm only walking one time a week. That's the self-acceptance of getting to that point. And maybe it's a little challenging for you. So what I want to ask you now is, what does that reflection require? What does it require to set a vision for where you want to go? And what does it require to be honest about where you're at now? You just yell it out. What does it require? It requires insight, right? It requires you to really look at something and look at it head on and be able to name it. It takes planning to get from the vision to where you want to be, from where you are now to the vision of where you want to be. Planning.
A little space and time.
And space and time. So let's go back to the planning. Planning is not so easy, right? You've all planned for something in your life, a party, you've planned for school, you've planned for something. Planning is actually a skill. That's why they're called party planners. People get paid to do that because planning is actually a skill you have to learn. So maybe in your clinics, you have to teach people how to plan. A basic skill like that. I've been in clinics where they needed help with Excel. We were asking people to track things on an Excel spreadsheet, and they didn't even know how to use Excel. So as a practice coach, my job was to teach them how to do that. They didn't know how. But planning is one of those things that you might have to train people on. Time and?
Space.
Space. What do you mean by space?
Mental space. Like you just gave us 5 minutes to have a moment.
Okay. So it's really difficult to change things if you're never meeting. So we're asking clinical teams and clinicians and medical assistants to change their workflow and processes, and they don't have protected time gridded in their schedules to meet. That's crazy.
Humility.
Oh, tell me about that.
Especially thinking about like personal change, but I think that it applies still to any change. It kind of comes with that self-acceptance and, you know, recognizing you're scared, recognizing your limitations,
Yeah.
being able to ask for help with Excel instead of pretending you know how to use it.
Yeah. So another story, as soon as you said that, I thought about one of our health coaches. So we did another study with medical assistants who were trained as health coaches, and their job was to help patients with diabetes, cholesterol, and hypertension. But what we found was that patients had a lot of other needs that were way more basic. So for instance, the health coach would tell the patient to go to the supermarket and buy fruits and vegetables, but the patient wasn't from this country and didn't know how to count change and was embarrassed to go to the store and buy food. So the first thing the health coach did was teach them how to count money. You can't move on past that. So there's this humility that goes with like asking for help and also knowing that you need the help. Like, I need help with this and I need to ask someone. Okay, what else? Anything else? Commitment. Tell me about that.
Well, you have to be you're going to fail, and it's okay to fail, so you need to have commitment and tenacity to try to push forward.
So what I picked up from what you said was failure. And I think that that's really key, because we all have to be okay with the fact that we're going to fail more than we're going to succeed. Do you accept that? You're going to fail more often than you will succeed, because it's the failures that actually lead you to your success. What? What did she just say? Think about it when you go home tonight, okay? It's true. All right. So something that Mindy just mentioned about time is that change requires persistence and time. And her neighbor too. What was your neighbor? What was your name?
Oh, Rob.
Rob. Tenacity, persistence, time. Rob. So this is a little bit of insight from Carolyn Shepard, who used to be the chief medical director at Clinica Family Health Services. We've done 10 million really dumb things over the years, Shepard said. But all the time we were testing to see what was something we should spread through the whole system. 10 million really dumb things. One of the most successful clinics in America. And if you were to ask her, how long did it take you from start to finish to become one of the highest performing clinics in the United States? How many years do you think she would say? Who said that? 10 years. 10 plus years. I should say anywhere like 10 to 12 years. 10 to 12 years. Did you all know that? It was going to take that long. How many of you knew that? You were ready for it. You knew that this journey to a high-performing medical home was going to take that long. No? How many of you thought it would take a lot less? How many of you thought it would take a lot more? Well, you got to raise your hands one way or the other. So I'm trying to get you mentally prepared, okay? And to prepare your clinics. This is a journey. It will take time. It is okay that it takes a lot of time. We're going to do 10 million really dumb things until we get it right, and it's okay. This is just to show you their pregnancy outcomes at Clinica. So when I tell you they're really high performing, I'm not making this stuff up. Their TNAA, their third next available appointment, is within 5 days. They have great pregnancy outcomes. They have great diabetes outcomes. They're just a really high-performing place to work. Their staff loves to work there. Their patients love to come there. It's a pretty amazing place. You can read all about them. They're published a lot. Okay, so how many of you have ever seen a car full of kids like that? Yeah, a lot of you. Okay, so this idea of are we there yet? I just told you it was going to take 10 years, and that might have crushed someone's soul in here. I'm not sure if it crushed everyone's soul, but maybe some of your souls were crushed. This happens a lot in a lot of institutions. I'm not even talking about primary care. I'm talking about anywhere in the business world, anywhere. Anywhere where there's change happening, this idea of are we there yet pops up, and there are reasons behind it. You have to look at the reasons behind it. You have to have the insight to look at what's really happening here. So one of the things that is happening is overcoming instant gratification. At my table, someone was talking about how we are all kind of geared towards wanting things done right this minute. We're all guilty of it. I want it now. I hate standing in line at the grocery store. I'm like, why is there a line? I want my food. I want it now. I want it now. I want it now. So with change, it takes a long time. You have to get over this idea of, are we there yet? I want it now. And one of the ways you do that is by setting goals. We call those stretch goals, right? Which is different than a goal that you're going to get to in a week, a month, or 2 months. Stretch goals are longer term goals that you want to set from the very beginning when you're setting that vision. Remember when you set the vision? You set those stretch goals. And that helps people see, wow, we're not going to get there for another year or 2 years? Yeah, it's going to take us 2 years to bring down our HbA1c. Or it's going to take us 2 years to bring down our TNA. It might. If you have really bad access and you have no empanelment, it might take you 2 years. And that's okay. But you have to get people over the idea that it's going to happen tomorrow for some things. The other idea is resistance. So you remember back to the bell chart of innovation. A lot of people are going to be resistant to that change. More people than not are going to push back on you than be like, oh, I love this change. It's the best change ever. No, get used to that. Get used to the idea that people are going to push back and be like, this is really difficult. I don't want to do this. This isn't the way I've always done it. And then you have to clarify the confusion. And that confusion comes around the vision setting. It comes around the messaging that goes with the vision setting. We'll talk a little bit more about messaging later. But everything has to be in line with each other. So you can't tell people we're going to do team-based care, but then you don't have teams at your clinic. Or people don't show up to work and people just get mismatched with whoever's there on that given day. That's not team-based care. You have to be very clear about what the vision is and how you're going to get there, and get over the role confusion. So in a lot of clinics, there's role confusion. So you ask them, did you write the roles down? Is there somewhere where it's written down? No. Well, how do you expect there to be any clarity? Nobody wrote it down anywhere? In one of the clinics that's in our system, they have what they call the Bible at the front desk. And it's not the Bible, but you go to the front desk and they have all of their policies and procedures at their front desk for anyone to look at. Patients can look at it. Anyone that walks in can look at their policies and procedures and roles. It's all in there, very clearly outlined. That helps to avoid confusion. The other thing is change fatigue. If you roll out one change after the other, after the other, after the other, and you use this like whack-a-mole kind of like strategy, this month we're working on LDL. Next month we're working on A1C. The month after that we're working on continuity. Oh my God. Okay, what happens? What happens? Whoo, yeah. People are like, I know if I just work on this, next month it's going to be something else. And the month after that it's going to be something else. So this is when the larger vision of why are we doing this becomes critical. Why are we doing all of this change? Why? And you as a practice coach have to help people figure that answer out. And as leaders and administrators in the clinic, you have to participate in creating that answer. That answer has to be out there, available, publicly, for everyone to see. And the last thing is boredom. People get bored. You gotta change it up a little bit and make it fresh and new and jazzy, jazz hands, okay? You can't just do the same thing over and over again. I'm not saying throw away the mission or the vision and create more confusion. I'm saying create a new poster, create a new game, create a new employee recognition system, create something that, jazz it up a little bit. Start doing potlucks. I mean, something. So we're going to do a little reflection. Okay. So what I want you to think about is to make all of these ingredients so far work. A lot of what I'm talking about is feeling like you can do something in the clinic. Like you feel in the clinic, or you feel even in your own work environment. You're not in the clinic. Maybe you don't work in the clinic. You work in an organization or a collaborative or whatever. But it requires you to feel like you can actually do something and you're going to get rewarded. Remember, we tried 10 million dumb things, Carolyn Shepard said. So to do 10 million dumb things, you have to know that it's okay to do those 10 million dumb things and fail, and no one's going to fire you. And you're not going to get punished, okay? So what I want you to think about is for yourself, your own work environment. Is it punitive, or is it what we call an open environment? And an open environment is an environment that's based on QI, so people are involved in quality improvement. There's trust there, and there's encouragement to try new things. Think about that. And then I want you to think about, in that same environment, are you encouraged to make changes? Are you empowered and encouraged to do something about things that you see that could, like, that process, that could be improved? Are you encouraged to do something about it? Now I want you to talk about it. What does encouragement feel like? What does it look like? And what does it sound like? So if your answer is yes, I'm hoping someone at your table has an answer of yes to question number 2, that you feel like you're encouraged. I want you to share with each other, what does that feel like to be in a place where you're encouraged to actually try and fail, and try again and fail again? What does that feel like? What does it require? How do you know that you're in that environment? You get my question? So share that with each other. 2 minutes. Group, table, neighbor, I don't care. Your choice. What does it feel like? How do you know you're in that place?